Good evening, everyone, and welcome to our session on your physical wellness and bladder cancer, which is going to be delivered by two specialists, a physiotherapist and a dietitian as well. My name's Jackie O'Kelly, and I'm one of the patient support officers here at Action Bladder Cancer UK. And I'm going to be delivering this webinar along with my colleague, Di Cook, who is the other patient support officer who works with me. And Di will be dealing with the questions at the end of the presentation. There actually might be quite a few questions coming along as a result of this presentation. So if we can't answer everything at the end, please rest assured that we're going to group the questions together so we'll get the themes put to our two speakers. And we are recording this session as well, so please do be aware of that. At the end of the session, we'll be putting our contact details on. So if anybody wants to get in touch with us after the webinar, then you'll have the contact details up on the screen. So on that note, can I hand over to our two speakers? And I think I'm right in saying that it's going to be Carly Stock, our physiotherapist, who's going to be starting the session. So on that note, I'll hand over to you.
Thank you very much, Jackie. I'll just share my screen. Hopefully you can all see that okay. Brilliant. Thank you very much for having me. I'm Carly. I'm a physiotherapist. I work in an outpatient cancer centre in London. And this evening, we'll hope to be covering, so we'll have a look at exploring the functional impact of cancer. We'll have a look at some definitions around physical activity and the difference between this and exercise. We can reflect on the cycle of inactivity. We'll have a look at some benefits of physical activity. We'll also briefly look at the pelvic floor muscles and some exercise after surgery. There are some considerations for being active, so we can have a look at this, and then just briefly a bit about fatigue at the end. So this just highlights the functional impact of cancer. So 85% of people receiving anti-cancer treatments are affected by fatigue. We know that 22% of people report moderate to severe problems with mobility in everyday activities. Fewer than 20% of people with a cancer diagnosis are meeting the recommended levels of physical activity. And we know that incontinence is a major concern for many people living with bladder cancer. And this often comes up as a reason why people don't engage in physical activity or exercise. So what is the difference between physical activity and exercise? Physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure, whereas exercise is a subset of physical activity that's planned, structured, and repetitive. So you might be thinking, how do I know what to do? I don't know how many minutes to do or what type of exercise to try. So these are the recommended levels of physical activity for adults and older adults. So this is quite a nice way that it's been set out, I think. So generally we should be active for at least 150 minutes of moderate intensity exercise per week. So you might think about that kind of 30 minutes, 5 times a week. That can include things like a cycling, a brisk walk, swimming, something where you're breathless enough, but you're still able to talk. Whereas you could also try 75 minutes of vigorous intensity exercise per week instead. That's something where you're breathing a bit faster, you're having a bit more difficulty talking, could be doing the stairs, doing some sport, going for a run. And also you want to try and build strength at least twice a week. And if you're 65 or over, generally it's recommended to do balance exercises twice a week. And that can help reduce the chance of frailty and reduce the risk of falling over. But we know that if you're living with bladder cancer, then for all sorts of reasons, different symptoms that you might be experiencing, it might not be possible to meet that type of intensity of physical activity, which is completely fine. So in that case, we try to minimize your amount of time that you're sedentary. So for example, getting up and changing your position every hour instead of sitting down for the whole time, because it used to be told that rest is best, but we're really moving away from that now. We know that actually it's not. Being active with bladder cancer is really important. So this is the cycle of inactivity, which I thought was important to show because it can show what happens if you do follow that pathway of resting. So if you start to rest, you might do less activity. Consequently, your muscles might become weaker. If your muscles become weaker, you can then use more oxygen. Your muscles might use more oxygen and then that's less efficient. And then you might feel more fatigued and rest some more. But if you rest more, you might then become fearful of activities that make you fatigued. For example, if you know that a flight of stairs is going to make you feel tired, or you're not going to feel brilliant after it, you might think, I just won't do that flight of stairs. And so you might continue to avoid those types of activities, which can make you more fatigued. And then you get stuck in this cycle. But there are plenty of things that we can do to try and break this cycle. We see this every day in the centre that I work in. So there are lots of things that we can do to help. There are so many benefits of physical activity that it would be hard to squash them all on one page, but these are just some of them. So enhanced quality of life whilst you're going through cancer treatment or a cancer diagnosis, that can be difficult, but actually we know that keeping active can really improve quality of life, which is so important to maintain throughout treatment. Reduced risk of falling, so that comes into strength and balance. Falling, we know it can be sometimes a consequence of frailty, and actually it's really important to keep doing your strength and balance. Increasing independence, we hear very often that if you're going through bladder cancer, you might rely on family or friends a little bit more, which is really normal, but also we hear how valuable keeping your independence is, and actually doing a bit more physical activity, being able to do your activities for yourself is really important for a lot of people. It can also help you to return to work, hobbies, leisure activities, volunteering activities. Improving your mood. I know that I'm sure all of us have been guilty at some point in our lives thinking, oh, do I have to do that exercise or should I bother going for that walk? But actually, once you do, you often feel so much better for it. So it can really be a nice thing to improve your mood. It can improve fatigue, which we'll talk a little bit more about at the end, and also your bladder and bowel function. And it can prevent muscle wasting, so prevent deconditioning, which is really important. So this was a campaign that was mentioned by the Chartered Society of Physiotherapy, but they called it Love Activity, Hate Exercise. And I thought it was important to keep because quite a lot of people come into me and they quite often say, oh, I don't really enjoy exercise. They say, Carly, I'm not an exerciser. But then they say, actually, I really like going for a walk with my dog, or I love going out with my grandchildren or my children or family. And actually, they don't really see that as exercise. But that definitely counts towards your physical activity. So I think it's really important not to stop doing what you enjoy just because you have a diagnosis of bladder cancer. It might be that we have to modify things slightly for a little while. We have to do it in a different way for a period of time. But actually, there are definitely ways to keep you active and keep you enjoying what you love doing. So these are the pelvic floor muscles, and they act like a bit of a sling. So they start at the front around your pubis and then they wrap round to your tailbone. But I thought there are sometimes myths associated with your pelvic floor muscles. So some people think that it's just women who have pelvic floor. That's not the case. Both men and women have pelvic floor muscles. Your pelvic floor looks a bit different, male to female, but we both do have them. Some people think I should just do my pelvic floor muscles during childbirth. That's also not true. It's really important that we all do our pelvic floor muscles. Everybody is recommended to do our pelvic floor exercises. And also, some people think it just helps with continence. So that is partly true. It does help with continence, but it can also help to prevent pelvic organ prolapse, and also it can help with sexual function too. So this diagram shows that if your pelvic floor muscles are relaxed, some people experience urinary leakage, and we hear really often that it prevents people from going out. Some people are quite conscious about it. People don't like to be too far away from a bathroom. But actually, sometimes with pelvic floor strengthening, you can see the picture on the right shows that with a strong pelvic floor, there isn't any leakage. So the app in the kind of far right, it's called the Squeezy app, and it's an NHS recommended app. I believe it used to be free, but I think it's now a one-off small cost. But obviously, it's not essential that you get this at all. But if you wanted to, it's quite a nice reminder to do your pelvic floor exercises, and it goes through a bit about how to do them. But some people just put an alarm on their phone or an alarm on their laptop. I had somebody who it prompts during her work. So they're definitely important to keep doing regularly throughout your day. And so this was from Action Bladder Cancer UK itself, that pelvic floor exercises and bladder training can help tone the right muscles, and leakage should gradually improve. If you do have a new bladder, that can stretch and then it'll be able to hold more urine, so you'll not be able to empty it as often. This is a really useful website. So they're called POGP booklets. So the pelvic obstetric and gynecological physiotherapy. They basically put together these booklets on how to do your pelvic floor exercises, because you might be thinking, right, now I need to do my pelvic floor, but how do I do them? It is important to say, have a look at the booklets for sure, but also you might want to have advice from a specialist physiotherapist who might be able to help you, because quite often people do it wrong, even when following the verbal cues. So some people end up squeezing their glutes muscles in their bottom instead, but that's not correct. It wants to be more internal than that. So is there anything that you should consider before exercising? Yes, normally it is safe to start doing something, but definitely there are a few things to be aware of. So the top one, parastomal hernia. So if you do have a hernia, it's true to say that you can be at risk of a parastomal hernia. So when the surgeons do their surgery, they'll make an incision in the abdominal wall, but then parts of the body sometimes can try to poke through. So you need to have a good kind of core and good strong abdominal muscles. But the way to do that generally is to build up really nice and slowly. If you do have a stoma, you can speak to a stoma specialist nurse for further advice about exercise belts. They might be able to tell you about how to progress your exercise as well, or referral to a local pelvic health specialist physiotherapist. This does vary borough to borough. I find that we mostly cover London, but also some surrounding areas, and even just one borough to the next, their services can differ. So I would say maybe just ask your team, your medical team or your GP, and they should know. If you can't find, there's also Find a Physio tool on the CSP website. So that's the Chartered Society of Physiotherapy website. And that's really helpful if you don't want to go by the NHS route. Some cancer centres also have access to physios. I work in a cancer centre, or there are also physios on the ward. It's usually safe to start doing something, but it can also be hard to think about exercise when you're dealing with the symptoms of cancer or side effects of treatment. But becoming more active can help you cope with this. So I would say just start nice and gently, nice and light, and it's about gradually building up. Also, it's important to say with surgery, surgeons will often say don't lift anything heavy, but I'm not the strongest person in all the world, so what's heavy for me is probably not heavy for everybody. So it's useful just to check with your surgical team, what do they mean by that, and then how to build up and how many weeks, you're on those precautions for. I'm hesitant to say exactly, what, because I think it differs slightly team to team and person to person. So I would say speak to a physio about how to progress your exercise. If you do decide to do some exercise, then it's important to do this safely. Even if you were very physically active before, you may need more specific support now, so still just ask. If you do have symptoms like pain, fatigue, nausea, breathlessness, or dizziness, and those increase, just stop and seek medical advice. Swimming, we always get asked about swimming, but just check infection risk, we normally say, with your medical team beforehand, and gradually build up how much you do in terms of amount and effort. So sometimes it can feel like a long way off if you're setting yourself a goal. Let's say you want to go back to running. Maybe it's more realistic to start with a brisk walk with a friend, first of all, and do those in short bursts, and then you want to build up and up slowly. So this is just very quickly a little bit about fatigue, but I thought it's important because it goes hand in hand with exercise. This is the most commonly used definition, but the cancer-related fatigue is a distressing, persistent, subjective sense of tiredness or exhaustion related to cancer or cancer treatment that's not proportional to recent activity and interferes with usual functioning. So what uses our energy? It's not just physical. A lot of people think that it's just exercise maybe or going out for walks that will use our energy, but it's not. It can also be cognitive and emotional. So if you're at a doctor's appointment, let's say, and you've really got to concentrate on what they're telling you, that can use your energy. Some people, even if they say, oh, my sister came over and we were just having a chat, they said, I didn't go anywhere, but I just felt really exhausted after. Why is that? That could still be fatiguing, just having a conversation with friends or family. And the physical, I know it says ADL, so that's just activities of daily living. So things like cooking, shopping, cleaning, those can all use your energy. Emotional, processing your diagnosis or living with your current situation and other life events as well. Treatment, recovery from surgery, that's huge. Types of medication, these can all contribute to fatigue. But how can we help it? So there is good evidence to show that physical activity can help to reduce the symptoms of fatigue, and being active may help you to boost your appetite, give more energy, and improve sleep. So I think overall what we're trying to send out the message is that actually rest is not always best. Some little periods of rest, absolutely, but also try to gradually build up the time that you're active. Just because you do have your diagnosis of bladder cancer doesn't mean that you have to stop doing what you love. There are physiotherapists that will be really keen to help you try to get back to that in some way, even if it's not exactly the same way at the moment. But overall, try to minimize your sedentary time and build up your activity, because it's really good for all the reasons that we said before, those benefits, but also to help your fatigue. Thank you so much. I think that's the end of mine, and I will hand over to Sophie.
Thank you very much, Carly. So let me open my slides up. And hopefully you can all see them. I know there were some problems. We had some messages saying that some other people were having some problems with the slides. So hopefully you can all see my slides. But just to introduce myself, so I'm Sophie. I'm a highly specialist oncology dietitian, and like Carly, I also work in a cancer centre seeing a range of different cancers and a range of different treatments as well. And I think Carly's talk leads nicely into my talk, because she talks a lot about fatigue and using our energy. And one way we can help with that and help you to feel more active is to have a good balanced diet. And so that's what I'm going to talk to you about tonight. We're going to talk about what constitutes a healthy balanced diet. We'll touch on multivitamin supplementation. I'll briefly touch on diet myths, and we'll speak about those times where you might notice unintentional weight loss and what you can do about that. We'll also talk about changes in your bowel habits and how eating and drinking can help with that. And then there'll be some time at the end for questions for both Carly and myself. At diagnosis and at times where you are during your treatment, we would be saying to eat a healthy, balanced diet. We want to help maintain a healthy BMI or body mass index, and that's going to help with kind of a range of different things. How do we do this? We want to think about what you eat and drink, and also how much of what you eat and drink, and we'll talk about that in a bit more detail. But essentially, a varied and balanced diet gives your body the nutrients it needs to stay strong, to work properly. And a bit like how we've said, keeping a healthy diet and a steady weight will help you feel stronger, have more energy. It will support your immune system and aid recovery from illness, or particularly with surgery. It will help you to feel better overall, and it will decrease your risk of your bladder cancer coming back, or your chance of other cancers, and it will reduce your risk of other heart problems, things like heart disease, diabetes, and stroke. I hope my slides are moving. You should be able to see the Eat Guide. I don't know, people might have seen this before, but this is what we picture as a healthy, balanced diet. And this was changed, I say a few years ago, but I think it's actually more than a few years ago. I'm just aware that someone's typing. Oh, that's just the Q&A, never mind. This was changed a little while ago and reflects what a healthy, balanced diet should look like. So essentially, I'll go through these in more detail, but a large proportion of our intake should be from fruit and vegetables. Another large part of it should be our carbohydrates, so things like our bread, rice, potatoes, pasta. And then the other kind of smaller sections of our plate, but also important sections of our plate, include things like our protein. And that's particularly important where I said aiding recovery from surgery, things like our sources of protein. And that includes things like our dairy products, things like meat, fish, eggs, alternative sources, things like nuts, lentils, beans, and pulses. As you can see, they've taken things off the plate, things like our naughty foods, things like our crisps, chocolate, all of those, they say, don't necessarily form part of what we consider a healthy, balanced diet, but we should be eating them less often and in small amounts. We should be obviously keeping well hydrated, and that's going to be important as well, particularly with treatment as well. I'm going to move on because we do talk about these in a bit more detail. As I mentioned, so fruit and vegetables should form the majority of our plate. And if you cut the plate into a T, so if you drew the letter T in the middle of the plate, half our plate should be vegetables or salad. And we should be eating about 5 portions a day. And if you think about what a portion is, an easy way is just about a fistful. That can include things like fresh, frozen, canned, or dried varieties. And we should be eating a rainbow because all the different ones give us different vitamins and minerals. As I mentioned before, carbohydrates form a very large part of our plate as well. And I think they get a very bad press, but I think it's about thinking about kind of the type and the amount. So opting for wholemeal, whole grain varieties, that increases our fibre. And we know that fibre reduces risk of, as I mentioned, things like heart disease, but also certain cancers as well. And again, a portion is about a fistful. And I know I'm guilty of this, but with pasta, we often fill our plate up, but actually only a quarter of our plate should be our carbohydrates. As I said, don't eliminate carbohydrates, but think about the type and the amount is really important. As I mentioned, protein is going to be really key for things like our growth and repair from surgery. So we should be eating kind of lean meats, things like poultry, fish, eggs. And as I mentioned, we should be including things like our plant-based options, and actually increasing things like our oily fish as well, aiming for kind of 2 portions of fish a week, and one of those should be an oily fish as well. Dairy, so dairy alternatives these days, you only have to walk down the milk aisle to see it's not just dairy milk anymore, but we should definitely be including these. They're a good source of calcium. And I can't remember if I put it on there later in the slides, but vitamin D, I would be recommending everyone in the UK, particularly in the winter months, probably about October, so about now to March, we should all be taking a vitamin D supplement, and that helps with our absorption of calcium. And we should be having good 2 to 3 portions a day. Oils and spreads, again, they say using smaller amounts and going for more of the unsaturated fats, so things that are from vegetable or plant-based sources rather than our meats. And then fluid, like I said, we should be aiming to drink plenty of fluids during the day. As I mentioned, limiting foods that are high salt, fat and sugar, because they don't really provide many vitamins and minerals. They will contain a lot of energy, but they can lead to weight gain. As I mentioned, going for more of the kind of unprocessed versions of things, limiting things like our red meat or processed meat. What I would say as well, though, is that some of these foods do have a place in our diet. If you notice any unintentional weight loss, I would be saying avoid any food restrictions and ask your cancer nurse specialist or doctor to refer you to a dietitian. I do mention it later on, so multivitamin supplementation. So generally, I don't tell any of my patients to be taking food supplements. There's no evidence to suggest that taking supplements can prevent cancer, help treat cancer, or stop it coming back. And actually, some high-dose antioxidant supplements during cancer treatment can make treatments less effective. But as long as you follow a healthy, balanced diet, you should be able to get everything you need from your food. Like I said, the only one we do struggle to get is our vitamin D, and I would recommend everyone in the UK is on a 10 microgram supplement, particularly during the winter months. I could spend all day talking about diet myths, and you only have to search cancer and diet to get loads and loads of cancer myths. I wish I could spend all evening talking about this, but just to touch on a few, you might have heard sugar feeds cancer cells. This is one of those myths that people talk about, and actually there is no evidence to suggest that cancer cells, like any cells, need energy, but giving them more sugar won't make them any bigger or grow faster or anything like that. And actually, cancer is unfortunately very clever. If it doesn't get the sugar it needs from our body, it will start to deplete our body stores, and that's when you find that unintentional weight loss. Just some other ones on there, and I've got all the kind of background for it if anyone has any specific questions. So they talk about turmeric supplements, but there is evidence that kind of studies haven't been able to show how we actually absorb them and how they have that effect on cancer cells. So evidence is always changing, and what I think about food myths is that we don't eat foods in isolation, and we also all live in the world, so we're also exposed to lots of different things as well. So it's very difficult to say that this causes this. So I would take everything that you read with a little bit of a pinch of salt and be careful where you're reading it as well. Weight loss, so just to touch on this as well, because weight loss with cancer is very common, and it can be as a result of the cancer itself. Carly said, our bodies, when you have cancer, your body is working extra hard, and it can be a result of the side effect of treatment. If you lose weight unintentionally, it's really important to speak to a dietitian, and they can advise on changes to your diet. They might provide nutritional supplements, and the key would be to promote that weight maintenance through any form of treatment. If you're losing weight, you have a small appetite. We talk about that little and often. So rather than eating 3 large meals during the day, I'd say go for smaller, kind of 6 smaller meals or snacks during the day, and avoid long periods without eating. It might be that your dietitian suggests adding extra calories. So a bit the opposite of what I was saying at the beginning. But as I said, there are periods during treatment where, you know, some of those foods that I said may be less healthy, you might need to be considering. Lots of different cycles during your treatment pathway that you need to think about. Just to touch on as well, some of the side effects of kind of bladder and treatments. Carly said fatigue and good nutrition and hydration is going to be key. I've not put it on there, but as Carly said, rest is not always best. But as it does say, do allow yourself time to rest when you need to. As I said, loss of appetite could be affecting people during their treatment. And like I said, going for that little and often, sometimes using a smaller plate and using things like nourishing drinks and snacks to help supplement your diet. What we say is making every mouthful count. So rather than asking you to eat more, I might be saying if you're having semi-skimmed milk in your porridge, switch it to the full fat version. That will get you some extra calories. And just to touch on as well, changes in your bowel habits. So where people have had their bladders removed, they often experience changes in their bowel habits. So where you've had that kind of bowel reconstruction to make that kind of new bladder, that would account for those changes. So some people might experience things like loose or runny stools after your surgery, or your bowels may be more frequent. That usually gets better over time, but do speak to your doctor or nurse, as they can prescribe medication to help with that. And also, just up in the top corner, I've got the Macmillan toilet card, which can be really useful. If you experience any incontinence worries, you can access that as well, and that helps to take off some of that worry about accessing a toilet. Sometimes things go the other way and you might get constipated, and therefore you might need laxatives to help opening your bowels, and also some medication, particularly things like anti-sickness medication or pain relief medication, that can make you quite constipated. Don't find yourself in a rut, because there are things that your doctor or nurses can do to help that. And that was a whistle-stop tour from myself. So thank you very much for listening to both Carly and myself. I think we're going to have time for questions.
Hello, thank you for that. We do have a couple of questions. The first one's for you, Carly. I'm dealing with pelvic fractures after radiotherapy for bladder cancer 2 years ago. I'm finding it difficult to manage bouts of pain and to know how much exercise to do during the spells when the fractures are not so troublesome. Pilates helps, but I'm not sure when to stop with the gardening and whether doing too much makes fractures more likely.
Thank you. I think that's a really important question, because your bone health can be affected due to some of the treatments. For example, radiotherapy. I would say first, if you haven't had a referral to a physiotherapist, I would ask for one, because this is exactly the type of thing that we can help with, because we can then go into questions like, how long have you had your fractures for? When did you sustain them? Where they were? What type of activity you're doing now that makes the pain worse? What we can do to make it better? The physio can also test like your muscle strength, your mobility, your movement. So I would say, if you haven't had a referral to a physio, I would ask for one. You can often do this via your GP, and they should be able to access directly the physio team in your local borough. But it is a good question, because you're right, you don't want to be in too much pain that then limits your activity, but you want to still be able to do your, those types of activities that you enjoy, like your gardening and Pilates. So the physio might be able to help you find some gardening activities that are comfortable and that will help you strengthen, or some types of Pilates activities that are really worthwhile in doing in order to strengthen. But yeah, I'd say ask for a referral.
Thank you, Carly. And one for you, Sophie. The next question is, I'm taking vitamin D supplements. Is it still okay if you're on blood pressure medications such as Ramparil?
Yeah, I would have thought that it's absolutely fine and take with Ramipril. As I say, I would recommend everyone takes it, and 10 micrograms is what you're looking for. I wouldn't go for kind of a really expensive vitamin D supplement. You can get them quite inexpensively over the counter. So don't be fooled into kind of any high dose supplements, just a 10 microgram.
Thank you, Sophie. One more for you. I've been on BCG immunotherapy treatment for bladder cancer, and I was looking for specific advice on foods to avoid, as the BCG can cause chemical cystitis, and having to avoid anything acidic, including yogurt, tomatoes, apples, oranges, etc.
I will be entirely honest with you. I don't know exactly, and that might be where one of our nurses could step in. I don't know 100% in terms of the treatment. So I don't necessarily want to give you the wrong information. I can certainly have a look and see if there's anything out there. I've not come across anything. And generally during treatment, there's not much I say to people to avoid. But as I say, I've not looked into that one in particular. The one thing I would say is hydration is going to be really important if treatment's causing cystitis. So definitely keeping well hydrated during your treatment and aiming for about 2 litres of fluid every day.
Thank you. And do email us if you would like one of our nurses to also add to any of the questions. That would be great. Another one, again for you, Sophie. Do you have any views on the benefits or otherwise of vitamin C supplements?
Yeah, so as I mentioned, what I would say is obviously I don't know what treatment you're on, and obviously I don't know what your diet is like. So it's very difficult to answer specific questions on that. What I would say is that, as I mentioned, high dose antioxidant supplements, of which vitamin C is, can interfere with certain treatments. And the other thing is that we often don't know specifically how things interact with treatments. I do know that you can get enough vitamin C from about 2 oranges in a day. So I generally don't recommend anyone takes the vitamin C supplements because it's one of those easy ones to get enough of. So if you're following a kind of healthy, balanced diet, you shouldn't necessarily need any vitamin C supplements.
Thank you. Another one about diet. I've had bladder, prostate, and lymph node removal. Now having frequent infections and hence multiple antibiotics. Will probiotics, kefir, etc., assist immune system or any other suggestions?
Definitely, yeah, there's a lot of kind of evidence to suggest that probiotics are beneficial because obviously the antibiotics are there to get rid of all the good bacteria. So definitely try different ones. There's lots of different probiotics out there as well. I think I've answered your question, but yeah, definitely, I think it's worth giving probiotics a go with frequent antibiotic use.
Okay, another one. You've got some really interesting
Yeah.
questions.
You're really testing me tonight.
I use 96% curcuminoids, I hope I've said that right, turmeric, to help restore my gut mucosa layer during cisplatin and cytarabine. Is this recommended?
So I've actually got turmeric as one of my things. I know I touched on it, but I'll tell you what it exactly says. So I've got here, the myth is taking turmeric supplements prevents and treats cancer. So they talk about curcumin, which is the yellow pigment extracted from turmeric, has antioxidants and anti-inflammatory products. However, studies have not been able to show how much can be absorbed by the body to have an effect on cancer cells. There are some early human studies showing some promise, but the particular enzyme has been shown to interfere with some chemotherapies. And obviously you mentioned you're on, I think it was carboplatin you said, and gemcitabine. Yeah, there might be some interference. And therefore they say that actually having turmeric in food or tea is fine, but actually they don't recommend high dose supplements.
Thank you. One for you, Carly. Is doing pelvic floor exercises still important for those with a stoma?
Yes, it is. It is still really important to keep doing your pelvic floor exercises. So I would say, yes, even if you do have a stoma, keep doing your pelvic floor exercises.
Thank you.
There's some good activity. There is a group or kind of an organisation, but they're called Active Ostomates, that you can always pop them into Google because they're quite helpful and they do have some quite good information about staying active with a stoma.
Great, thank you. Sophie, one more for you as well. I've started immunotherapy. Can I take fish oil, cod liver oil, etc.?
Yeah, I would have thought so. It's not one I've looked into specifically. I suppose in terms of general advice on immunotherapy or any kind of cancer treatment, I would be saying the food hygiene laws are the same as when you're pregnant in kind of terms of just being careful with food hygiene. That was just to touch on as a side note, it came into my mind. But in terms of, was it fish oil supplements you said? I would have thought that kind of thing. Yeah, cod liver oil. I would have thought that kind of thing is absolutely fine during treatment. But again, if there's any more specific questions, do check with obviously your CNS or pharmacist or doctor.
Brilliant. We've got some great questions tonight. We have another one. I have a peristomal hernia. What exercise can I do without compromising the hernia?
Yeah, that's a good question. I think some people do have hernias already and some people are not particularly symptomatic. But again, it depends on kind of what exercise you're doing already, if you're using weights, if you're not using weights, but probably again, speaking to a physio. I know that sounds really vague, but speaking to a physio is important because they'll be able to test your strength, see exactly what you're doing, see where the stoma is, see where the hernia is rather, and just make sure that you're not doing anything that's going to make it worse because they can advise you a bit better about specific weights or type of weight that you're allowed or not allowed to use.
Thank you. Another one about having a stoma bag. I'm worried about going back to swimming. Any advice?
Yeah, that comes up quite often actually, and people concerned for various reasons. Some people are worried about their actual stoma bag and like adhesive, but if you speak to your stoma nurse, they're brilliant at knowing there's different types of attachments that you can have and like different adhesives. So, they'll find what's right for you. And I'd say some people do worry about whether they might, the appearance of it as well, if you feel a bit self-conscious, but I'd encourage you just to go and still do it. More often than not, we're all thinking about ourselves and how we look rather than how other people look. And everybody that I have worked with who does get back to swimming actually really enjoys it. And we have somebody who's training, he's got stoma and is training for a triathlon now. And not saying we all need to go back into that level of swimming, but he's swimming very happily with a stoma. So I'd say try what works for you. And even if you just go at a quiet time, some gyms actually do some good off-peak discounts. So I would definitely check that as well. It's worth knowing. I think it's Better Gym, they often have, for people going through treatment, some really cheap deals out there for swimming. So go and have a look at that. So maybe you want to start at a time where it's a bit quieter, or go with somebody and just try it out, I'd say, because often people do swim really normally with a stoma.
Yeah, thank you. Would you recommend, you might not be able to do this, but would you recommend any belts to wear to support a hernia?
Yeah, again, I'm not sure about like specific types, but we often speak, I know I often speak with our stoma nurses who can often help with that. So I'd say probably your stoma nurse might be a better person to speak to.
Okay, thank you. Bear with me 1 second. I think one might have just come through.
Yeah.
Do you have any recommendations, please, for supplements or herbal remedies for stage 4 bladder cancer?
No, like I said before, one of those, and I'm just looking at my notes because they go into it in a bit more detail, but there is this myth that complementary alternative medicines can increase survival, reduce recurrence, optimize treatment, alleviate side effects, and boost the immune system. However, as I've mentioned, things like high dose antioxidants might actually stop treatments being as effective. And as I've mentioned, they talk about vitamin D. Like I've said, that's the only one I'd really be recommending. If you're not able to eat a nutritionally complete diet, then I would say taking just an over-the-counter general multivitamin would be fine. As I said, I would avoid anything in kind of high doses, but it talks about a few different ones. There's a Boots General Health A to Z, Centrum Advanced Complete A to Z. So there's lots of different kind of over-the-counter standard multivitamins, but there's nothing I'd be recommending, this is the best thing you should be taking, or that kind of thing. And as I say, I'd be more focusing on a healthy, balanced diet, because more often than not, vitamins and minerals are better absorbed via food than taking kind of a supplement.
Okay, one last question. What are the main foods to boost immunity?
Yeah, as I said before, I'm reluctant to put one single food on a pedestal, but generally eating a range of different foods, they all give you different things. Like I said, eating kind of a range of fruit and vegetables. And like I said, not just eating 5 bananas in a day, but actually going for 5 different fruits and vegetables, having a range of different colours. And that sounds really silly, but actually the different colours do give us different vitamins and minerals. As I mentioned, we should be having good sources of protein, and those unprocessed and high in kind of, like I mentioned, the oily fish is one that we definitely in the UK aren't getting enough of. Things like our dairy. So as I mentioned, obviously we need, as someone mentioned, fractures, and obviously therefore calcium is going to be really important. Things like, I've gone completely blank on the question, but just a general kind of variety of food and fluids as well is going to be absolutely key to giving us everything we need. And like I say, I would be reluctant to say one single thing is what we should be having. There's definitely things we should be having less of. Things like, as I mentioned, things like our red and processed meat, alcohol. Obviously, we know there is an increased risk of certain cancers with drinking alcohol. So I wouldn't be saying cut it out completely, but we know that we should be having less than 14 units a week. We should be not saving all of our units for one particular day. We should be having alcohol-free days as well. So alcohol is one we should be definitely reducing. Hopefully I've answered your question. Sorry, I've gone off a bit of a tangent, but hopefully that answers your question.
Okay, I think we're coming to end of time now, but we've just had one more question posed, if you don't mind. Green tea, can that help bladder cancer?
I'll be honest, like I say, I've not looked into it completely, but I would be surprised if there's a study. I wouldn't be surprised, but as I say, it's very difficult with diet to eliminate everything and say that it is the green tea that causes X, Y, and Z. Again, more than happy to look into it, but nothing I've heard of. And like I say, being careful with where you read things online. What I would say is that obviously green tea is high in caffeine, so being careful of that.
Yeah. Thank you. So many interesting questions. Thank you for sending all of your questions. And thank you both. That brings us to the end of our session. It just leaves me to say a huge thank you to both of you for your time and expertise and for answering the questions. That's amazing. And to thank everyone for attending. Please do check out our website. We're going to put on our contact details in a second, so there will be a slide at the end. So please check that out for our contacts. And just do check our website and all the resources on there. We do have a resource that talks about healthy diet and also one that talks about exercise. So please check them as well as all the other resources we have. And that just leaves me to say thank you and have a good evening. Take care.